Hi, this is Joey Mohan, and today I'm going to be presenting on lymphedema. Lymphedema is a disease of the lymphatic system classified as either primary, which results from congenital abnormalities, or secondary, which is the result of damage to the delicate tissues that make up the system. My presentation will focus on secondary lymphedema of the upper extremity that occurs following a patient's journey through breast cancer treatment. The primary function of the lymphatic system is to aid in the body's immune response and maintain fluid homeostasis. It is made up of a system of vessels and nodes within which lymphatic fluid circulates lymphocytes. At its periphery, the lymphatics absorb abnormal cells, cell debris, and extracellular fluid from the capillary beds. This fluid is then filtered by the nodes and lymphoid organs such as the spleen. When a patient undergoes treatment for breast cancer, there may be significant trauma to the tissues of the breast, chest wall, and axilla. Greater than 50% of all breast cancers occur in the upper outer quadrant, where the primary lymphatic tissue for the upper extremity exists. Oftentimes, depending on the severity of the cancer's progression, multiple lymph nodes are removed from this area. In other cases, radiation therapy is performed, further damaging these tissues. What results is a decrease in the body's ability to clear interstitial fluid and also to circulate the essential cells of the body's immune response. For a time, the venous aspect of the circulatory system, as well as the remaining healthy lymph tissue, can compensate to prevent the extracellular fluid from accumulating. But when certain occurrences, such as a scrape or a cut to the extremity or restrictive clothing, which leads to further prevent the circulatory process, this can lead to excessive swelling. Therefore, prevention is key with lymphedema. Patients need to be educated on things that reduce their chances of developing the swelling in the first place, such as avoiding cuts, grazes, and heavy lifting with the involved side, avoiding direct heat, such as sunlight, saunas, steam, avoiding restrictive clothing and blood pressure cuffs on that affected side. They need to use insect repellents and sunscreen, as well as gardening gloves, and they need to keep the skin healthy, clean, and moisturized. Regarding treatment, the current gold standard is complete decongestive therapy, which consists of a system of light exercise, skin care, manual lymphatic drainage, which is a light massage technique, and compression bandaging. Other treatments include surgical interventions such as vascularized lymph node transfer, where healthy lymph tissues are harvested from another area of the body and transplanted to the patient's axilla. Another surgical intervention can be surgical-assisted protein lipectomy, where surgeons remove accumulated fatty tissue in the limb, which relieves the burden on the remaining lymphatics. One new therapy that is currently being developed involves the use of Kinesio Taping, along with complete decongestive therapy, where a trained physical therapist or occupational therapist applies specialized tape in an attempt to improve lymphatic flow by lifting the epidermis. Although there is currently no cure for lymphedema, studies have shown a significant reduction in limb size with complete decongestive therapy, as well as maintenance with these gains when patients are compliant with their treatment. However, the focus on prevention is of the utmost importance. In conclusion, the diagnosis of breast cancer can be devastating to the patient. This diagnosis is followed by numerous invasive procedures such as biopsies, surgeries, and reconstructions. Often there is further treatment such as radiation and chemotherapy. It's easy to understand how difficult it is for this population to then have to live with the fear of one day developing lymphedema, and if they are diagnosed, to know that there is no cure. Progress is being made, however, with breast and lymph node sparing surgical procedures, patient education, and treatment options such as Kinesio Taping. Thank you.